Good afternoon, everyone. This is Doc. Just wanted to hop on here and give you an update. Let's see, I'm now about close to 16 days out from my radical prostatectomy. I thought that I'd begin by, in summary, just briefly describing what's happened to me. So in June, I was diagnosed with prostate cancer. That was just through a general PSA screen, followed by a biopsy. It was a Gleason 7, intermediate. Went in and had a radical prostatectomy via the Da Vinci device. And you can look at my other videos and see where I was post-op and then a few days after that. And now I'm about 15, 16 days. And man, I just got back from walking for an hour. Yesterday I walked for 2 hours. I no longer have a catheter. And just to kind of tell you, some of the side effects are real. I do have some incontinence. Surprisingly, it's not as bad as the doctor had told me it was going to be. It's frustrating. There's no question about it. I'm not going to lie and tell you that it's not a frustrating issue. It's a life-changing type of thing for a man that was very active and so forth, so on. There is some erectile dysfunction. Literally, I think that's dictated by age. Obviously, I'm not 40, I'm 62. And right now, that's not my priority. It's not my concern. So I have been back to the doctor. In fact, I had a consult with an oncologist. So, all the fears that had creeped back up came and went, and now I have a pathology report. So the good news, no lymph nodes, good. Bad news, it did break the capsule and it migrated into seminal vesicles. Now, the best way I can describe that, if you can imagine a bed and you're looking at it from the top and you have some nightstands attached to it, the nightstands are the seminal vesicles. And so it migrated into the nightstands, if you will, and it also, if you have bedding over your bed and some of the sheets are coming out underneath your bed, that is a positive margin. I have some positive margins on both sides. I think the left is a little bit more. I still need to read my pathology report. That being said, I am classified as a stage 3B. And I'm being a physician, I'm very aware of what that basically means. I have micrometastasis. It can't be seen. Now, the encouraging part is that for all intents and purposes, I could be cured. He may have gotten it all. But because of the breaking of the capsule and by the definition and classification, I am at a very high risk for return. And my oncologist, my surgeon referred me to, is a rock star as well. Dr. Barker, man, I'm telling you, these guys, they have very difficult jobs, but he literally spent like an hour and a half with me explaining to me what options I may have. So the next step is me getting a ultra-sensitive PSA test. That's, again, the marker for prostate cancer. If it's undetectable, I return to the oncologist with a treatment plan. It could be anything from radiation, to hormone therapy and radiation. If it's detectable, we have different arms we can go with. I think here's the satisfying news. Everybody wants to know, well, how long are you going to live? I don't think a doctor can really tell you that, you're going to live X amount of years. And I get it. But he did say that if I chose to do nothing, that in about 8 years, he would probably see me in the emergency room with a pathological fracture. So to me, that was encouraging, saying that the worst scenario is that I will have to manage this for the rest of my life. It may be a point where it's cured and then it returns and I get more treatment. And, I'm not going to go there yet because I'm not there. But sometime after the holidays, I will probably be going in for some radiation and hormone therapy. As to what degree, I don't know. But The other good news is that my quality of life is going to be good despite treatment. I'm going to go through some valleys with the hormone therapy. Basically, what that means is they bring your testosterone levels very low, kind of keeping any active cells at bay. I'm not sure if it's cell death. I'll have to kind of do some research there, but it's going to keep any active disease at bay. And then the radiation, of course, is cell death. It kills anything that is existing around the bed. And if they missed a lymph node, it'll kill that as well. Yeah, so, this, I'm adapting. I'm beginning to understand and accept that this cancer is going to be around, and there's always going to be some anxiety based on it. I wish I could tell you that I had prostate cancer stage 1 and it was within the capsule. And, I started to think it doesn't matter what stage you're in. There's always that possibility that this thing can reoccur. It doesn't matter if you're prostate 1. Of course, the chances are less. Stage 2, chances are much less. Stage 3, higher risk. And of course, I'm very grateful that I'm not a stage 4. That's bone metastasis. We'd be having a different conversation at this point. But I'm planning on living a very healthy life. Now, I can't get ahead of myself. I have an ultra-sensitive PSA test yet to do here sometime in the next few months with another doctor's visit and then returning back to the oncologist. So I still have a ways to go. And but meanwhile, what I plan to do is stay in the now. So I've enrolled in a intensive inner healing program. I went to my boxing gym today. I didn't box, but I went to my boxing gym today, and I think the message I'm trying to deliver here is stay connected to your support system. Stay connected to your passions. Stay connected with your activity. Don't throw in the towel. Because that dictates your quality of life. And today was a beautiful day. I returned back to work last week. It was challenging. Don't get me wrong. There's thoughts that come in and out of my mind. I'm only human, so that's to be expected. But today, I'm wearing my boxing t-shirt. I'm healthy. I'm young. I'm walking around. I walked for 2 hours yesterday, an hour today. I did some steps. I shadow boxed today at the gym. My appetite is intentionally, I'm kind of watching what I eat. I'm learning more about nutrition. Even though I thought I knew it all, I still didn't follow instructions, but I'm learning more. So what I'm hoping is that these videos uplift somebody who is going through this. Also, if you have any comments and you're going through this, please let me know, because I am going to post these on YouTube, and it's always nice to have that support system. I've gone about 8 minutes, and I understand that most people lose interest after a period of time. So I'm going to keep you updated as I go along. It'll probably be after my ultra-sensitive PSA test, and let you know if it's detectable or not. I was warned about PSA anxiety, and it's very real. I'm just going to expect that it's going to come back positive, and that being said, I'm ready to knock that out, and let's go to the next step. But I'm very grateful today, and again, you have a lot to give. People love you, and I can't thank enough people at this point for their prayers and thoughts. Okay, you guys have a great weekend. Peace out.